The word pharmacology comes from the Greek words pharmakon, drug, and logos, study. It is the science of drugs and how they interact with living organisms. Pharmacology explores the chemical properties of drugs, their effects on the body, and how the body processes them. Pharmacology is a vast and complex field that encompasses many different areas of study. At its core, pharmacology seeks to understand how drugs work and how they can be used to treat and prevent disease. One of the key aspects of pharmacology is understanding the relationship between the dose of a drug and its effect. This is known as the dose-response relationship. For example, paracetamol is a common over-the-counter pain reliever. It works by blocking the production of certain chemicals in the body that cause pain. Penicillin is an antibiotic that kills bacteria by interfering with their cell wall synthesis. The World Health Organization, WHO, defines a drug as any substance or product that is used or intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. This definition highlights the wide range of substances that can be considered drugs, from simple pain relievers to complex chemotherapy agents. Pharmacology is divided into several branches, each focusing on a specific aspect of drug action. 1. Pharmacokinetics. This branch studies how the body absorbs, distributes, metabolizes, and eliminates drugs. It helps determine the appropriate dose, frequency, and route of administration for a given drug. For instance, pharmacokinetics explains why some drugs are taken orally while others need to be injected. 2. Pharmacodynamics. This branch examines the biochemical and physiological effects of drugs on the body and their mechanisms of action. It explores how drugs interact with their targets, such as receptors, enzymes, and ion channels, to produce their therapeutic effects. 3. Pharmacotherapeutics. This branch focuses on the use of drugs in the prevention, treatment, and management of diseases. It involves selecting the most appropriate drug therapy for a particular patient based on their individual needs and medical history. 4. Toxicology. This branch studies the harmful effects of drugs and other chemicals on living organisms. It investigates the mechanisms of toxicity, the symptoms of poisoning, and the treatment of drug overdoses. 5. Chemotherapy. This branch deals with the use of drugs to treat cancer. It involves developing and testing new anti-cancer drugs and designing effective chemotherapy regimens. 6. Pharmacogenetics. This branch explores the role of genetics in drug response. It studies how individual genetic variations can influence a drug's efficacy and toxicity, paving the way for personalized medicine. 7. Pharmacogenomics. This branch is similar to pharmacogenetics, but focuses on the broader impact of genomics on drug discovery and development. It uses genomic information to identify new drug targets and develop more effective and safer drugs. 8. Pharmacognosy. This branch deals with the study of drugs derived from natural sources, such as plants, animals, and microorganisms. It involves identifying, isolating, characterizing, and studying the therapeutic properties of natural products. 9. Pharmacoepidemiology. This branch applies epidemiological methods to study the use, effects, and outcomes of drugs in large populations. It helps identify patterns of drug use, assess drug safety, and evaluate the effectiveness of drug therapies in real-world settings. 10. Pharmacoeconomics. This branch evaluates the economic aspects of drug therapy. It analyzes the costs and benefits of different drug therapies, helping healthcare providers and policymakers make informed decisions about drug use. Understanding pharmacology is crucial for the safe and effective use of medications. It enables healthcare professionals to make informed decisions about drug selection, dosage, administration route, and monitoring for adverse effects. It also helps them educate patients about their medications, empowering them to take an active role in their healthcare. Pharmacology plays a vital role in drug development and research. By understanding how drugs work, scientists can develop new and improved medications to treat a wide range of diseases. They can also identify potential side effects and drug interactions before new drugs are made available to the public. Furthermore, pharmacology contributes to public health initiatives by providing insights into drug abuse, addiction, and the development of drug resistance. This knowledge is essential for developing effective strategies to address these critical public health issues. Pharmacology is not just limited to healthcare settings, it is relevant to our everyday lives in numerous ways. For example, when we take over-the-counter medications like pain relievers or antacids, we are engaging with pharmacology. Understanding how these drugs work, their potential side effects, and how to use them safely is essential. Pharmacology also plays a role in our food choices. Many foods and beverages contain naturally occurring substances that can have drug-like effects on our bodies. For instance, caffeine in coffee is a stimulant, while alcohol is a depressant. Knowing how these substances affect us can help us make informed decisions about our dietary intake. In conclusion, pharmacology is a fundamental science that underpins our understanding of drugs and their interactions with the human body. It is essential for healthcare professionals, researchers, policymakers, and the general public to grasp the basic principles of pharmacology to ensure the safe, effective, and responsible use of medications.